I was going through a challenging relationship, a personal relationship, and I was in the common room. I was a student and I was crying and she just happened to pass, and she didn't keep walking, she stopped. And it was one of those moments where you can offload to a stranger because they don't have any emotional attachment. And, you know, she could have thought crazy and carried on walking, and she didn't. She sat and she listened to me, and she cried with me. This person who I'd never met, you know, sat crying with me, emotionally engaged in the pain that I was in. And the empathy that she gave me was literally the biggest act of kindness that imprinted on my heart.
Welcome to Curious Chats and Kind Acts, the podcast that celebrates difference, kindness, and the little things we can all do to make our world a better place. Join me, your host, Sonia, co-founder of the Axe charity, for some open, authentic and fun conversations with lots of interesting, extraordinary, everyday people who are all a little bit different. Prepare to have your curiosity piqued and your heart warmed as we explore the ways we can all make a difference in the world, no matter how small. So get ready to be inspired, uplifted and motivated to be the kindest version of yourself. Let's make the world a kinder place, one conversation at a time.
Hello and welcome. I hope you're having a great day. We have a proper treat in store for you today. I'm chatting to Kate, who I know from my Macmillan days. I interviewed her for a job at the Clatterbridge Cancer Centre. She blew me away with her passion, resilience and determination, and we have remained friends since. She talks so passionately about her service. I have to say though, it's a tricky listen at times, and it's not an easy job that she does. Now, she runs the metastatic spinal cord compression team. I'll let her explain, it's a mouthful. However, this is a rare and honest insight into the life of a healthcare professional. She discusses her amazing service and how she supports patients to make impossible choices about their final months of life. We then explore how Kate got to where she is now. She had a difficult childhood, caring for a dying mum whilst holding down 4 jobs, right the way through to her office romance and meeting her soulmate. We really do cover it all. So sit back, listen, and enjoy Kate's very incredible story. There is a trigger warning here. We do discuss cancer emergencies in depth and the difficult choices people have to make. So, hello Kate. Kate, what's your surname now? Lacey.
Lacey, yeah.
Formerly known as Kate Parker. You'll always be Kate Parker in my head.
That's okay.
Thank you for your time today. Do you want to explain who you are and what you do?
Yeah, so I am a therapy radiographer by background. I've worked in oncology for the last 24 years, mostly in radiotherapy as a clinical specialist, but for the last 7 years I have been creating and setting up a regional metastatic spinal service. Okay,
so for the average human like myself,
for the average human, so metastatic spinal disease. So when somebody gets cancer, they can have a cancer that spreads to a different part of their body, becomes known as a secondary cancer or metastatic cancer. And the most common site for that cancer to spread is to the spine, because bone is a really common site that cancer spreads to.
I didn't know it was the most common, the spine.
Yeah, so the reason why it is the most common is because different tumour groups have different areas that they metastasise more readily to. So breast, prostate and lung are known as common cancers that happen to a lot of people. And they're the 3 biggest high risk groups because breast, prostate and lung cancer spreads to bone quite easily. So when it does, the area of the spine can be put at pressure. Your spinal cord makes your arms and legs work and affects your breathing and things. So if there is anything that causes your spinal cord to be compressed because of cancer, it can cause you to lose the power of your arms and legs, so become paralysed. It affects your bladder and bowel, so you can become doubly incontinent. Once you lose the power to your arms and legs and you become doubly incontinent, you can no longer have any active cancer treatment, so you can't have chemotherapy, for example. Or
why not?
Because your system can't cope with it. Your physical body, if you're not ambulatory, if you're not moving around, your body can't tolerate the toxicity of those treatments. So patients there is a scale that's called performance status, and it is a scale that's used to determine whether people could tolerate treatments. So if somebody was quite old and frail and didn't mobilise a lot around the house, this is not somebody with spinal cord compression, just generally, they wouldn't be able to tolerate, high dose chemotherapy in the same way as somebody that's active and fit. So they would have either not be eligible for that treatment, or they would have a reduced dose of that. And it's just to do with the physiology of your system working, and if you are paralysed because of your cancer, then you can't have active cancer treatments.
So metastatic spinal cord compression is basically where there's a growth in the bone that could compress onto your spinal cord.
Yeah, so the majority is a growth in the bone, because the cancer is spread to the bone, and that growth grows and puts pressure on the cord. But you can have cancer that is spread to the fluid around your spine, which sometimes happens in things like breast cancer, or actually within the spinal cord itself. It doesn't really matter which of the three modes of transfer it is, because they cause the same symptoms, they cause you to have the same...
And is it dependent whereabouts on the spine it lands?
Absolutely.
As to what you can't do?
Yeah, so in a nutshell, the upper part of your spine, the bit that's around your neck, is in charge of your arms, and anything lower is in charge of your legs, your bladder and bowel. Around the mid of your chest is what controls your breathing. Anything in the upper also controls things like your swallow. So, worst case scenario is to be paralysed and have your breathing at risk and your swallow at risk.
And I remember, I'm sure it was you that described to me the halo.
Yes.
Which I have to say sounds wonderful, but is probably the most horrific thing I've ever heard. But just tell me what the halo is.
Sure. So there's two types of halo. There's one that's used in spinal surgery, which is predominantly to stabilise the spine. So it's a metal frame that gets placed in your skull, and also...
You've said that very nicely. Placed in your skull.
Yeah, as in bolted to your head, which is what patients have described it as before. And it stabilises the upper spine. So that's the halo that's used in surgical terms. There is a type of halo treatment that you can have for radiotherapy, which is a similar principle, but the halo is fixed to the bed so that it keeps you in exactly the right position to allow really high dose radiotherapy treatment to be delivered. There are just treatment techniques that require... So
would you only... Because I thought when you've had the halo fitted, you had it on. Do they take it off after treatment?
Yeah, so there are a couple of different ways that it can be done. The halo that's used for surgery is you are usually kept in it for a long time, and for our patients for life, because it's what's stabilising it. It's like, wow. And again, whoever knows that decision around that you want to live. But these people have got a thing bolted to the head so that they can't move the neck and back very much. Yeah. And they can't ever take it off. They've got to sleep in it. Yeah. They've got to eat in it. It really affects your quality of life. And it's like, do you talk to people about the quality of life when you're having this? How do you have that horrendous conversation? Yeah, absolutely. I mean, fortunately, it is a minority of people that need that type of extreme intervention. And the reason for that is because the C-spine has got less number of vertebral bodies in it. The thoracic spine is much longer. So the majority of patients have a spinal cord compression that affects the thoracic spine just because there's more of them. The higher up you go, the more delicate, the bone's a bit more intricate, the other critical structures in the area are a bit more intricate. And so the conversation around any treatment, any intervention is with that expert team. So that will be the spinal surgeons that will be saying, if we don't do this, this is the risk benefit to you. If we do this, this is what will... But I think informed decision is quite difficult if you don't know what that actually is like to live with. I've seen and met many patients who have, acted on the information they were given at the time, but actually you don't really know what that quality of life looks like unless you're living that quality of life. Fortunately, it's not a majority of people that require such an extreme intervention. But there are a lot of our patients who require some form of bracing, for example, or external support to aid their mobility once they've had a spinal cord compression. and they can be quite cumbersome, and you might need a different one for showering as you do for mobilising, and they're quite restrictive, and they're also a psychological reminder of what's happening because you're physically having to put something on every day. But the benefit is that it preserves the spine for a bit longer.
Keeps you alive.
Keeps you alive.
And that's it. I mean, it's horrendous, isn't it?
They're difficult conversations to have.
Yeah.
And for us, the difficulty of the conversation is quite often very rapid. The onset of this can be completely sudden. It's like having a trauma. It's like having a car crash and then having an accident and needing an emergency intervention. And, for a lot of people, they're now living with cancer and living well with their cancer. So to then get an emergency situation that happens in the middle of that when you're actually quite well, it's not like other oncological emergencies like a neutropenic sepsis where people feel unwell.
Gonna go stop when you use jargon.
Sorry, I'm using jargon.
Neutropenic sepsis. We don't need to know what that is, but
it's a cancer emergency where somebody gets unwell.
Yeah.
And the point being that actually the difference for spinal cord compression is people are usually very well.
Right.
They're living with their cancer, they're very well, but then they get something that's an emergency situation that happens. It's a very different situation to somebody who is clinically deteriorating and unwell.
It's because it's the shock, it's the surprise, you think you're over
the psychological element of having a car crash in the middle of your day.
And then a week later you could be fitted with one of these awful halos.
No, it'd be within that day.
Really?
So for some of our patients, 20% of our patients don't even have a cancer diagnosis. They go to A&E because they've got these symptoms. They have some scans and some tests done. We find out that you've got a spinal emergency. Oh, and you've got cancer. And we don't know where your cancer actually is because we can't do those tests right now because we've got to treat your spinal emergency. Oh, we're going to put you in an ambulance and send you across for surgery or to emergency radiotherapy. Now, it's like, poof, poof. It's such a traumatic experience for those patients.
Wow. Well, right. On that cheery note, let's...
But what is cheery is actually because people are better at recognising those urgent signs and symptoms, the quicker we get the intervention in, the more likely we are that we'll preserve that.
Yeah.
Stop you from being paralysed and stop you from being doubly incontinent and keep you in your active cancer treatments, which will, convey you having more life. And in a very gross nutshell, when we started 7 years ago, the average survival was 30 days, and now it's 7 months. So we've bought 6 months of life for people, and that is a long amount of time when you would have been flat on your back, doubly incontinent, staring at the ceiling for what was 30 days.
I tell you what, you've got to be quite happy about that. Does that make you proud?
It makes me very proud, absolutely, to think that actually, because it's not just about making you live longer. The difference in your quality of life if you're not paralysed or doubly incontinent is massive. What you can enjoy with your family and your friends and your close ones is a very different landscape if you're not paralysed and doubly incontinent. Yeah. And staying in your active treatment, it also allows that time for psychological transition. How do you go from I'm doing all right with my cancer and I'm living and I'm functioning and I'm at work and oh bang, now you're going to die in 30 days and you're going to be flat on your back. That is a very different position to living with your cancer and you might be deteriorating or you might not have, years ahead of you, but what you do have is a significantly better quality, and also then your experience is better. So you preserve someone's life, you help them stay functioning and therefore have a better quality of life, and the experience in the meantime is better. So it's not just about survival, it's a whole package of benefit, really. I
think you've already spoken about where it's at now, but just give us a quick summary of where we're at 7 years on.
So after that big turning point of creating the pathway coming through oncology, the plan really originally was just to set up the service and let it kind of self-propagate, but it got legs very quickly. And what was needed was a lot of education around the network. So you described about A&E and patients going to A&E, and there's some really subtle red flags that people would present with, and it was about teaching other clinical teams in those emergency care interfaces to not just know if someone's rocking up paralysed that you need to be thinking about cord compression, but actually if they've got these very early signs, because if they've got those early signs, the earlier we pick them up, the quicker we give the intervention, the better their outcomes are going to be. And so a lot of work was spent with all of primary care, the A&E teams, the acute trust, the acute oncology services, all of those other services, teaching them the subtleties, but also knowing how they could contact and when they could contact. And the biggest change that came was allowing people to come to us when they suspected metastatic spinal cord compression, and not just when there was a confirmed diagnosis. Because in a time critical situation, you haven't got time to wait for MRI scans to be reported, and all these kind of points that are the difference between getting somebody here quickly or not. And as soon as we said, even if you're worried and it's wrong, let us help you sift through the information. And that's the bit that's changed outcomes, is people could contact, it's been a 7-day service for the last 2 years. The service has grown to be a team of 14. We're the only service in the UK that has a designated metastatic spinal team. The team itself consists of all different disciplines, physios, OTs, radiographers, so that there's a shared learning. It's not just a hierarchical team, it's very much a team of women who are strong, advanced practitioners in their own right. And I'm really fortunate that for the last 2 years I've been part of the NICE guideline committee for the new updated guideline that was published in September of last year. And they've used the Cheshire and Merseyside model as a real world model data set in the national guideline.
Wow.
Yeah.
And you said it's a team of all women, so all 14 are women.
Yeah.
Wow. Why?
I don't know, to be honest. It's just been coincidence, I think. I don't know. I just think that actually what's come out of that has been... It's not very often that you work in a team where you're an equal and a leader, a peer and a leader. I am a therapy radiographer by background. I've worked in pre-treatments. I've got lots of advanced practice experience, but I'm not a physio or a nurse, or haven't worked in computer planning. So I started to recognise that actually when the patients came, it was great that I could do X, Y, Z, but I couldn't do T and Q, and the nurse could bring that and the physio could bring that. And there was just something that naturally evolved around it being more comprehensive for the patient. I can give them this and this, but the physio can give them this and the nurse can give them this. So isn't it great that we can provide all that within one service? And then what came out of that was all this additional development work. So things like every advanced practitioner carries a work stream of improvement. So the education lead is somebody that's a radiographer by background, worked in computer planning, a different area to me, so has a completely different thing that she brings to the MBT discussion. But she's also worked at the university for the last 6 years as a lecturer. So she's created our education strategy across the region, and everybody carries something that is about their individual skill set.
Something they're passionate about as well.
Absolutely. So they own it, they run with it, they feel invested, they feel emotionally engaged in it, and they can see how, as a collective, that whole thing around the sum being better, more than the individual components, collectively they are a force. And
it's like there's a lot of respect there.
There
really.
is, absolutely.
There's a lot of respect. Like, this is my skill, and if you need stuff about this, I'm the best, but actually I'm not for this, this and this. So I respect your opinion, and this is your patch, this is your...
Absolutely. So there's something in NHS methodology called host leadership, and that is the model that I've tried to base it on. It's not a hierarchy of I'm the most experienced, so you all have to learn from me and this is how it is. This is a team of advanced practitioners, strong women who all bring something else to the table because of them as a person. Just like at interview, I felt like I brought being a patient and a carer and all those things to the table. They all bring something else, and collectively there is a absolute mutual respect. So one of the Band 7 members of the team, who's an advanced practitioner, was my leader here for 30 years. She worked on oncology. She's a very experienced mother of radiotherapy, taught me everything I know. I value her beyond belief. I now lead her. I can't tell you how humbled I am to lead the person that taught me everything I know. But that's the good thing about being, part of this team, is I lead this team, I don't manage this team,
I love it.
Yeah.
And what about numbers now then? So 7 years ago, how many are we looking at? Not many, I'm guessing. How many?
So in the first 6 months, when we were set up the service, we had 178 referrals. I remember thinking, oh my gosh, 178 people have got a spinal emergency. 1,400 last year. And that was just of the ones that we got to know about. There is still a group of people that deteriorate very quickly and can't have anything, and therefore, miss a window of opportunity. And that's the whole moving the curve again. So, the next phase is, how do we then shift to being around earlier identification when somebody gets a spinal met and not just an impending cord compression? How do we pick it up even earlier? So yeah, huge increase in numbers. And that's a reflection of more people living with cancer, more people living with common cancers like breast, lung and prostate, more people having, advanced treatments so they survive their cancer and they then have the risk of this.
But some of that, surely, you're just finding out about them.
Absolutely. So there are people that would have presented to a hospice, for example, who would have been thought to have been end of life, that now the hospice will ring and say, okay, they've had 1 and 2 treatments before, have we got any other options? People died within 30 days of their first cord compression. We had a chap last week who came back with his 4th.
Wow.
So we're talking about people getting a 2nd and 3rd cord compression. Brings a whole level of complexity that's different. People that have had previous radiotherapy and we're having to re-irradiate, and there's other organs at risk there. How do you make sure that what you're doing is still in the best interest of that person and isn't going to cause them more complex side effects about their treatment? It's groundbreaking and it's forefront, and it brings with it a whole load of a
conundrum that you absolutely love to solve.
Yeah, absolutely.
I can feel your passion coming out of you. Right, I'm gonna change track a bit now.
Yeah, great.
So let's go back to early Kate. Where did you grow up and stuff like that?
Where did I grow up? So I was actually born in South Africa.
Were you?
Yeah, my mum and dad went to visit my uncle who lived there and stayed for 10 years. And whilst they were there, had 2 out of the 4 of us. Me and my sister were born in South Africa, moved back to England when I was 5. And yeah, lived on the Wirral since then, really. Siblings have 4, well, there's 4 of us. 2 older and then a younger sister. We're spread across 16 years, so a nice kind of age mix. Lived most of my younger childhood with my mum because my parents had separated, and then mum developed lung cancer when I was 10. Mentioned before that I was a childcarer for, well, I was off for the most of a year off school when I'd just gone to secondary school. Spent the first year of secondary school being a carer. Was a bit of an unusual position to be in, but brought me a load of experience that I didn't realise would be so valuable, further down the line. And
was it grim then, though? Like, how on earth?
Yeah, so the type of lung cancer my mum had an average survival then of only 4 months, and she entered into a new chemo trial and I actually lived for 17 months, so, got a lot more out of it, but, was very unwell, and, like you say, cancer treatment was very different. It's like, I was 12, so it's like 30 years ago. Yeah, she was very poorly and very unwell and dying, it wasn't a...
Well, and you were the main carer for her at that age?
Yeah, so although I had my eldest brother, he was working, I had a younger sister. I was a bit of a mother hen anyway, I was a bit mature for my age, and but yeah,
So were you looking after the younger kids as well then? So
Leanne was only 12 months younger. What really happened was I run the house, really, and that at points when my mum was well and she wasn't on her chemo and she could,
So were you paying the lecky bill?
Yeah, so I cooked my first Sunday dinner at 10.
It's mental, that, isn't it?
Yeah, it's mental. I look at my kids now who can barely make a piece of cheese on toast and think, how did I run a house?
A 21-year-old that can't use the washer.
Yeah. Yeah, so, I did the food shopping and, stood for 4 hours on a Sunday and ironed the clothes for the week and, did all that sort of stuff. And in between the times when my mum was poorly and tried to, care for her. She had some sisters as well that would help with her care, but yeah, the function of the house and I remember the GP coming to do a home visit one day and saying, you'll be a nurse by the time you're 15, because I was there giving her a medication and, kept a bit of a chart and, all the rest of it.
And then she sadly died when you were 12?
12, yeah.
And so what happened then?
So mum and dad were divorced. Dad wasn't really on the scene. came back to look after us for a bit. Didn't really work out very well. He wasn't used to having children. Mum and Dad were probably divorced for a reason. When he came to look after us, I realised why. And then, so he left after a year. That left 4 children. But my eldest brother was older than 18, so we never hit social services radar because, you know, I was 13, Leanne was 12, but he was a bit older. And then at 15, me and my youngest brother got a flat because my eldest brother got a wife and a baby, and we were all living in a tiny council house. So
have you been back to school at this point? I
was still at school at this point. I had 4 jobs, worked weekends and evenings at school, yeah, and I had started back at school, but I'd missed like a lot. It was catch up, and you know, I was bottom set of everything. But I had a different perspective then, and I kind of had this insight that actually, you know, I lived in this grotty flat, you know, where there was druggies in the stairwell and, you know, people's houses being raided. And I can remember being 15, sat on my bed thinking, don't really want this to be the rest of my life, you know, and I've got to put my head down and do something different. And I was in bottom set for everything, and I worked my backside off and came out with a string of A's and B's at GCSE, went on to do A-level, went on to university, and yeah, got in a very different indirect route than what most people would have got.
Yeah, but so determined. I mean, you've got to catch up because you've missed a year of your school life because you've been looking after your dying mother.
Yeah.
So not only did you catch up, but you came out with some really good grades whilst having 4 jobs.
Yeah. Yeah, that's pretty much it.
Do you not look back and think, how on earth did I manage that?
Do you know how I managed it? Because I had a group of about 4 teachers who really helped me. They could obviously, you know, I'm what 15-year-old as a flat. You know, I was all my peers were going out drinking around parks and, you know, having a social life. I was like washing net curtains and doing a food shop and getting some lecky on. You know, it was a completely different. They could obviously see, you know, that it was a bit different for me, and they helped me. You know, these teachers, you know, really, really advocated for me, and, you know, helped me knuckle down and catch up. And I didn't read my first book till I was 17. You know, I was so behind education wise. I didn't come from a family of, you know, my huge Catholic family that was like this enormous entity. Nobody was academic. Everybody worked in a factory. It was like the Cadburys or Vauxhalls. If you're a man, it was Vauxhalls. If you're a woman, it was, you know, that's literally how it was. And I just, once I was living in this flat and had a different experience, I just felt differently about it and thought I didn't want that for me. You know, I didn't have the base of parents. And then my dad died. So
your dad's died now as well. How old were you then?
I was a bit older, but he went off the scene from about 16. So, and became a bit of a recluse, I think, from the sounds of it. Didn't really engage with any of his family and lived a very separate life. Didn't engage with the 4 of us. And then died of cancer, ironically. So we were actually informed by the police. I mean, how ironic is that? The police knocked at my brother's door and said he was down as next of kin. We had to have an inquest. He had a lymphoma, and, you know, I remember thinking, you know, that I wonder, he didn't even know he had cancer. Went to A&E, was admitted, died, type of thing. And I often think, you know, as a cancer specialist, you know, I wonder how that would have been had I been part of his life, or if he'd have been part of our life or wanted to be part of our life.
Yeah.
But yeah, so yeah, he died when he was in his 60s.
Blimey. So do you feel like you haven't really had a childhood in the nicest possible way?
It's very true. It's very true. You only know what you know.
Yeah.
So it was just my experience, and you are a product of your experiences, you know, But yeah, I haven't had a traditional childhood like most would have had. You know, my mum and dad had divorced at 8, which isn't uncommon, but, you know, that was the first. Well, moving from Africa when I was 5, moving then when I was 8 when mum and dad divorced, moving schools, all the upheaval that brings, and, you know, becoming a child carer, mum dying. Yeah, I suppose that's not really... It's not your traditional,
okay.
It's not a traditional childhood.
So you go to uni. Which uni you go to?
University of Liverpool.
Did you?
Got in through clearing, got in through the skin of my teeth. Struggled at A-level, took on too many. I loved art. I had this absolute passion for art, but knew I wasn't really going to get a career out of it. So I thought, I know, it'd be a really good idea to do 5 A-levels, including art. It's not a good idea, let me tell you that. So it really dragged down my grades for the other subjects, the ones that I needed to get into it. So I didn't know anything about radiotherapy, and at clearing, I was like, oh, it's a bit of an issue, didn't get the grades I needed. And a careers advisor said, have you thought about radiotherapy? And I was like, what is radiotherapy?
What did you want to do?
Diagnostic radiography.
Okay.
It's the only discipline of radiography I knew of. And I only knew about that because my sixth form college did an introduction to medicine, and we went to Arrow Park, God, this is 30 years ago, and spent half a day at each department. So you got insight to loads of different departments for 2 weeks, and I loved it. And the radiologist, who I won't name because she became a patient of mine, I mean, talk about full circle, later down the line, I just felt inspired by this woman. She was just a bit crazy and a bit like flamboyant and really passionate, and it made me be interested in the discipline that she was teaching about. And I thought, oh, I wanted to be a therapy radiographer. And then when I didn't get the grades for therapy radiographer, I went into clearing in radiotherapy, and I came here to have a look, and I just thought, oh my God, I love this. This is what I want to do. And I just knew.
What did you love about Clatterbridge?
I loved, well, then it was a community hospital, and it had that real community sense of, you know, and I had been here with my mum when she was having her treatment.
Wow.
And I knew it, like the main corridor that we've just walked down, I walked down as a 10-year-old bringing her for her treatment. And there was just something that connected that as well for me. And, you know, I never realised that you could do something around cancer and something technical with it. Whereas, like, you know, being a diagnostic radiographer, you get to use loads of different, you know, you could be CT or MR, and it had a bit of a technical element to it, and that inspired me. Whereas for radiotherapy, you can do all those things and look after people with cancer. And I just thought, hold on a minute, this is a whole thing that I know about that. I know how to do that. And I went into our class of 25 with the lowest grades in the whole class.
I bet you came out top though.
I came out all right.
So did you have a bit of fun at uni? Please tell me you're going to discover alcohol and boys at this point.
I did. More alcohol than boys. I lived, I couldn't afford to go and live in. I was still like kind of with me 4 jobs and still working weekends and doing all the rest of it. But I had this huge family that I belonged to, but after my mum died, I realised that actually I didn't really belong with them. There was a breakdown in, you know, relationship with the wider family, and I kind of moved away from that for the benefit of me, and met the other 5 people that were at clinical placements here at Clatterbridge. The 25 was a split between the Christie here in Preston, and I walked in, and we are still, the 6 of us, still best friends. We still 30, you know, well, it started 20 something years ago now, 25 years ago, we're still the closest of friends. And in fact, one of the team is the person that is my best friend in real life.
Oh, how lovely.
Yeah. So, you know, I became best friends with her on that day that we started here, and our careers have gone in very different directions. We've got very different skill sets. And yeah, she was working at the university and I was growing the service, and she was like, that's way too passionate. There's obviously something that I need to jump on with that. And
so that became your family, your community, really, that group of people.
They absolutely did. In line with one of the jobs I got in the summer between university and college was I met a family who had an autistic son, and they were setting up a home school for him. And I started a summer job there, and they became my surrogate family, and I moved in and lived with them for a while. Yeah, they took me to Massachusetts to train at the Autistic Institute, and I worked weekends with their son who was autistic, and I lived with them, and they are still family to this day.
Isn't that's almost like the kindness of strangers that became?
It absolutely was. So they were the opposite to the extended family that I'd ever known. They were a very small family, but had a very diverse life and lots of, you know, different experiences to this kind of commune, which is what I felt I'd left. And between Bridget and Pops and the girls, I just found the world. I just hadn't had any experiences that had been regular, and they let me be part of what was a regular world and have regular experiences.
Is that like when you figured out who you were? Because up until then you'd been a carer,
Yeah, I think becoming part of a friendship group where, they accepted all those differences that I had, and, I was still the same as them. I was still at university with them on the same course, doing the same, walking through the same doors every day. But yeah, absolutely. That's when it was almost like I knew how I was. It just couldn't come out because there was other things that made it not a priority. Whereas I was able to be me then, and able to,
Who are you? Who were you?
Then or now? Or
well, then were you the fun-loving? Is it the passion coming through?
Yeah, I feel like people always describe me as having quite a lot of energy and being enthusiastic about things, and I felt like actually that was allowed to be at the forefront, and I was allowed to enjoy some uni life, and Clatterbridge became a real sanctuary for me because it stood for something that was just about me. These people that I was around now were all about Kate. They were not about Kate the carer, Kate the person who had 4 jobs. They were not about any of that stuff. Kate that belonged to this strange commune of a family. It was where I felt like I wanted to be, and it was a safe haven for me.
Well, and actually consistent in your life in the
absolutely,
yeah,
absolutely.
There's a massive loyalty there both ways, really, isn't there?
And actually, I was quite good at what I did. I didn't realise that all of those experiences, having 4 jobs from age 13 means that you've actually worked in quite a lot of public sector type roles, which brings a lot of experience that you need when you're dealing with patients. So there would be a crying patient, and you could see everybody like, oh my gosh, what to do? Whereas I'm like, let me through. I want to be there at the thick of it, at the cold face, and that really helped me in my clinical. And that only really sunk in for me that was a skill set that I had when, as a 3rd-year student, I won the clinical prize, which was voted by the staff who you'd worked with.
Oh, that's the one you want.
Yeah, absolutely. It was called the Eddie Lai Memorial. It was named after a staff member who worked here before my time. I didn't know and wish I had done. It was in his memory. So the Eddie Lai Memorial plaque sits on my shelf at home.
Did you get a cash reward as well, or was it just a plaque?
Oh, I think it's just a plaque.
Oh.
That's enough.
And so what's going on at home now? You're studying, you assume you get your first job here?
Yeah, so actually we were at the point where there was a national shortage for radiographers, so we got a golden handshake. They literally paid us additional money to come and work here.
Wow.
That no longer exists in the NHS. So yeah, I got my first job here.
How much did you get as a golden handshake?
It was something like £1,200.
Which back then was a fortune.
Well, when the starting salary was £17,000.
And you got blind.
Yeah,
and
band 5.
Did you have to pay for your degree then, or were they still free?
They were still free, but I did leave with a student loan of about £7,000, which I paid off really quickly.
Yeah, I bet you did.
Yeah, I needed to get that out of the way.
Yeah.
And then I work in a load of roles here that are quite technically focused, but actually it's always the patient stuff that floats me boat. It's always the more... In fact, I did a ward placement with the nursing teams in my first couple of months, and I was thinking, I've picked the wrong discipline here, because radiotherapy is a 3rd physics for starters, and it's got a very technical element to it. And whilst I was competent at that, it wasn't the bit that fed me soul.
It's always the people.
Yeah, it was absolutely always being with the people. And so I progressed into a senior role quite quickly.
Surprise, surprise.
But it was still in a technical area that was around treatment delivery, wasn't still. And then I got the role in planning, which was pre-treatment, which was that first interface that patients come to, not just the cold compression patients, but everybody. And I loved it. So the treatment set was different. You worked with the same patient for, they could be coming for treatment for up to 6 weeks. You'd get a rapport with them, you'd know more about them and their families, and I loved that element. But actually, the rabbit in headlights, oh my God, what's ahead of me, was much more my bag. And being in pre-treatment, I felt like I could positively impact patients' cancer journey if they have a positive first day. But
is that not, like, how many patients are you seeing a day? Like, a lot?
Like Well, in pre-treatment here, it was like 30.
And you're not like by the 28th where they're coming like how do you keep yourself so positive after when you...
Because it's their first time every time.
And can you... what do you do? Do you put yourself in their shoes? Or... because, you know, some days you've got a bad period, you've had a row with someone.
Yeah.
How do you keep yourself... this is the most important thing, this 28th patient.
I don't know why I do feel like that, but I do feel like I could do that. I felt like, you know... and I wonder whether there is something subconscious about me being that child carer and knowing what that experience is like firsthand. That if you do have a crappy first experience, how that really does impact the rest of your time. That actually, that was a big driver for me to make sure. So like, the first thing that came to my mind was, you know, that you wouldn't know who was going to walk through the door. It could be a 20-year-old, it could be a 90-year-old. You know, they could have had cancer for a long time, or this could be their first experience. And that variety, but that cutting your cloth, you're really personalising the care for the person, because you don't know what's going to be their main issue. You know, is it that they're worried they're going to die in 6 months, or are they worried because they've left their cat at home and actually, you know, or their husband with dementia or whatever. And you've got to be able to... so before personalised care became personalised care, that enabled me to really kind of centralise how you made that person the centre of your universe for that hour. So let's go back to your life then. So you're in a steady career. What's going on at home? Challenging relationship that I was in for quite a long time, that I left and felt that left at the time of not long after I became qualified, and I realised that actually this is the right thing for me. I then had... so I'm hit about 30 now, 29. I go into my first long-term relationship after a not very positive relationship, and meet the person that I have 2 children with. Unfortunately, another not very good relationship. But I have these 2 gorgeous young children. I'm a single parent, they're 3 and 4. Work and my friendships maintain being this stability. Bridget and Pops and Tom are still with my extended family and their daughter Catherine. You know, I've still got this consistency, and that helps me get through those challenging personal relationships that you have. Because
that's hard, single parent, full-time job. Well, it's probably not hard for you, like, because you...
but it was, you know, because you want to be... my eldest child had a disability, was born deaf, and, you know, had other complex additional needs. So, you know, you're trying to be, you know, a good parent, but you're trying to be a good parent to somebody who's got a lot of additional needs and work full time. But that time I'm not yet in this role. I'm still in my therapy radiographer role, which is the planning one, and, you know, supporting people on their first day. And then I stumble across a couple of Macmillan roles that I think actually I need to.
So was that quite nice, because it was a different kind of work, so you could focus on your family a bit more, or was it you wanted a new challenge? Or
I wanted a new challenge, and I felt like it was all very technical here. You know, the dose distribution of radiation is really important for accurate treatment, but it does not float my boat.
Yeah.
And absolutely I want to help people's outcomes, but actually I was much more about how do I really make it a positive experience and the best it can be for those people. And the first role was around older people, so it was the older people's pilot in 2010, and it was a national pilot, and the Cheshire Merseyside had a couple of bases. It was something that was done in acute trusts, but they wanted an education element from it, so I, as the tertiary lead, said I want to do that bit. And it was the first time I'd done anything that was national, so it was a national piece, and it was also, I had a particular interest in older people. There was something about being a younger child carer that made you value the wisdom of older people much earlier than my peers recognised. So I did some of my part-time jobs and some of my voluntary work I used to do. I remember when I lived in one house with my brother after I was 15, and we lived in the flat, we moved to another house, and it was opposite a nursing home. And I used to go and volunteer in the nursing home just because I loved it.
In all your spare time.
In all your spare time, yeah. But there was like a midwife who was a resident at the nursing home, and she was the midwife of the community. She was like, 80, but she delivered my mum.
Oh, wow.
We discovered in like a conversation, and she used to be saying like, pass me the baby, and
It happens a lot to you, doesn't it?
Like
there's been a few examples in this interview where you've talked about, like, the radiographer that inspired you then cared for. The
cycles.
There seems to be, and there's another one. You came to a workshop we did around kindness.
You're not going to believe this. I know exactly what you're going to say.
Will you say it?
The person sat next to me was somebody who had helped me through a personal crisis 10 years before. I bumped into her this week.
Did you?
I haven't seen her since that workshop.
So this was when
my gosh,
we were doing
really
some workshops. It was around my masters, around kindness, and I invited lots of Macmillan professionals to come in, and there was, I'll name her, Sandra Rowlands. She was a very kind person, and you yourself, and you just said, I remember it, you were like, I just need to tell you about an example of kindness from someone in this room.
Yeah, because I couldn't believe that she was in the room. She didn't even remember the act of kindness. It was one of the most prominent acts of kindness, and still is to this day, that I've ever experienced. I was going through a challenging relationship, a personal relationship, and I was in the common room. I was a student and I was crying, and she just happened to pass, and she didn't keep walking. She stopped. And it was one of those moments where you can offload to a stranger because they don't have any emotional attachment. And, she could have thought crazy and carried on walking, and she didn't. She sat and she listened to me, and she cried with me. This person who I'd never met, sat crying with me, emotionally engaged in the pain that I was in. And the empathy that she gave me was literally the biggest act of kindness that imprinted on my heart. And then I'm sat in your workshop, and she sat next to me, and we're in a safe space talking around positive experiences we've had of acts of kindness. And I remember crying in the workshop because I'm trying to tell this woman what a positive impact she had on me. She didn't even remember it.
Like, I don't remember
that. She didn't even remember it, which is great, because I don't want her to be like, traumatized by my...
But that just shows that, like, for me, it was such a lesson around kindness, because it's like, you don't always know what impact you're having. Like, for her, it's just what she does. She'll always...
And then this week, I'm at a conference where I'm delivering around the service and all this growth, and she's at the same conference. She's delivering some workshop, and she comes and stands next to me, and she's speaking to the facilitator. She goes, "Oh, hi," and says hi to me. And I know when she says hi to me, she hasn't got a clue who I am. And in a way, it almost makes the act of kindness even more powerful.
Because it's just irrelevant to her. It's just how I am.
It's who she is. It doesn't matter. It wasn't because I was this like special person there. It was just who she is. It's what she does.
Yeah. I love that. Right, so let's get...
But those full circles.
Isn't it? There's quite a few in your life.
Quite a few.
Yeah. So you've got your 2 lovely kids.
Yeah.
You're working here.
Yeah.
Let's get on to your next relationship.
Yeah. So I then get... My next relationship is actually the beginning of this role. So I start this job. I'm appointed as the Cheshire Merseyside Metastatic Spinal Cord Compression Coordinator. Try saying that in your first week when you're introducing yourself to everybody. And
I think I wrote that job title.
Yeah, you did.
Sorry.
Well done you. And I now go to work in a different directorate in this trust. I've not worked in a different directorate before. I know people, and I've had, that older people pilot secondment brought me relationships in this directorate, which used to be called Crest. And day one, I'm like, right, they put me in an office. And in fact, pre-day one, they have a team meeting of like 30 people, and they say, come along to the team meeting and meet everybody. And I'm like, great. So I go along, and this is before my role starts, and I meet everybody, and there's somebody sat to my left on a computer with his face in his laptop, and I'm thinking, rude. That's what I thought. And my then line manager brings me over to him and the person sat next to him and says, "Oh, this is Kate, she's going to be sharing an office with you." And he says something to me, and and I'm like, oh, he was rude. And I came back to my desk and I Googled who he was on the internet in our work, decided who was that person I've never met before and barely spoke. And then day one, I come into the office and I'm like, oh, where should I sit? There's space for 4. And Richard has a desk next to the window, the best desk in the whole office. And he says, oh, that's where you're sitting. And points to the seat behind the door, but the door smacks every time you open. There's a wooden chair, there's not even a desk chair, and there's a disused Christmas tree on the desk. It's like the least appealing spot in the whole office. And I'm like, great, this is my new spot. And so, so January the 1st, I'm in the office with Richard and Pam, and I watch Richard be the most amazing male co-worker I've ever seen. And I say male because there's something really special about his comms and his leading of... I've just talked about the fact that I lead an all-female team, and actually the dynamic of that is great, but there's something that brings having a leader who just brings a different element. You know, when you step into the office and there's somebody crying in your office every day, you know, it's a different ball game if you've got a good set of comms. And he was just really good at communicating, and he was really good at his job. And I just thought, you're really good. And then we had this friendship that grew really quickly. I'm in a new role. He was going through divorce and was separated from his partner, and not very long into it, I knew that he was my soulmate.
You knew?
I knew straight away.
Did you tell him?
He knew first.
Oh, did he? Did he tell you first?
No.
Oh.
I say he knew first. It was one of those situations where you both don't realise that you're both thinking the same thing. And, you know, I'm in a new job. He's, you know, not long out of, well, months, but out of a relationship. And it's new for both of us. And you're thinking you're just developing a friendship, but actually I knew it was much more than that. But then, you know, we're in a work situation where we share an office. We have very different roles, you know, and it's also a new relationship, so you're kind of, you know, wanting to make sure that you're good, solid friends.
Where was your first snog? Was it in the office? No,
it wasn't. Are you disappointed?
Yeah.
No. We've never had a snog in the office.
No.
Yeah, never. Never had a snog. The closest we've had is we went for coffee on the bench outside, which is not really like anything exciting. Sorry, disappointed in there. Yeah.
Where was it then?
At his house.
Oh.
So we talk about full circle. He lived under a minute's drive from where I lived.
Really?
Yeah. And we didn't even know that we lived in the same area. And then there's other massive full circles. So I'm at his house and I'm like, who's this? I know this lady on this picture. And he's like, that's my mum. And I was like, so when in my older people's role, I went to Age UK to look at some hospital from home work that we could do. And I have this meeting with this very intimidatingly powerful woman, is the only way I can describe her. And she is like, oh my gosh, the enthusiasm is like pouring out of you. And there's some kind of comment about me being really, you know, excited and, you know, yeah.
Tigger.
And now, yeah, I'm like, I think excited puppy at a table is something that might be a... Yeah, and I had worked with his mum.
Wow.
I know. And she was chief exec of Age UK, and I had done this piece of work with her in my older people's pilot, which is like 7 years earlier, and I was like, this is crazy. But yeah, and then Richard and I very quickly fall in love. We have a baby.
Wait there. So you fall in love in the office, but don't even have a snog in the office. How did you tell people?
Well, that was a bit tricky because he was still going through divorce. I was, you know, still new in this role. I wanted it to be established, and then we decide that actually we do want to be together, we are soulmates, and we get pregnant very quickly.
Oh, okay, so you were forced into the matter.
Yeah, except we weren't forced into the matter, but it was kind of like, I also wanted it to kind of be when we were ready, because I was very conscious that we both were, you know, our roles were very important to us.
I was going to say, your job is your identity for you. It's
Absolutely.
Very important.
Yeah.
So.
And I don't want, you know, neither of us want for our peers or our seniors to perceive that there's anything inappropriate from a...
I mean, you do very different jobs, don't you? But yeah.
It's still something that was important to kind of make sure that it was... And it's maintained, you know, that's continued. We both have quite senior roles within the organisation. You know, we both love the organisation and put a lot into it. And it's very important that, you know, for us that we maintain that integrity, because it's important to us as people.
I'd never put you together.
Really?
Yeah, because I don't know, I don't know you well, but I was here quite a bit with my job, and Richard was just so sensible and serious.
Yeah, but you see, he's absolutely crazy at work.
But you're the opposite. You're like this vivacious, outgoing. So actually, maybe it is an opposites attract.
Well, no, it's
Isn't
because
it?
he has a very good professional persona that he is then very different outside of work. So he is even more gregarious and outgoing than me outside of work.
Get out of here.
Honestly.
Wow.
Yeah, he's even more...
But how did you see that in work? Just like those late nights over the computer.
He's just
cracked a joke.
Do you know what it is? He's very emotionally intelligent. And being very emotionally intelligent and being, a good communicator and being good at engaging made it a very interesting... he's a good catch.
Good, if you punched above your weight.
I was definitely punching above my weight.
That's what I say every day.
Yeah, it definitely was.
So you get pregnant, you come out to your colleagues.
Yeah.
And then how do you move on? You've only just got married, so you didn't get married for a good while.
Yeah, so we move in together, so we've got, our older two and Callum.
And how was that? How was, because he's like a stepdad, isn't he? Is that gone okay?
Amazingly.
Yeah.
Blending families can be tricky, but again, that's the whole emotional intelligence and him being great at everything. And his family are amazing, and absorbed us into their family.
And would you say he co-parents with your two older kids? Because this
co-parent with me?
Because I'm a step parent, and there's been times where I've just had to bite my tongue because I'm like, well, I wouldn't do it this way, but...
No, the only way for us is to co-parent because we're both all or nothing people anyway. Yeah. It's got to be. It's just the way that's worked for us. I can see why other people do it differently, but that wouldn't work for us. And also because then we went on to have two children.
Does he tell them off properly?
Yeah.
You see,
we do everything together. Right? No, we do everything together like that. We just
go, Joy, you need to have a chat.
Yeah, no.
So he does the telling off as well.
Yeah, but I suppose he's also better at the challenging stuff. The tricky conversations tend to always fall for him, whereas there's no tricky conversation that he shied away from. That a lot of other people would have shied away from if they were their parent, let alone if they were their co-parents.
But I suppose if you've got two kids together as well, then actually...
Yeah, to solidify us as a unit, you can't have a half-hearted for half of it and half-hearted for not. It's worked well that we've done that way around for us.
So you've now got two kids.
Yeah. So we now have a 16-year-old, a 15-year-old, a 5-year-old and a 3-year-old.
That's lengthy, isn't it?
Yeah.
You've got a lot more school plays to attend. And why get married? Why after however many years? Because we were like that. We were a good few years. Why bother?
I think for us it was just it solidified that unit. It was something that we always wanted to do, but life kind of got in the way. Amongst all that, there was a couple of pandemics and a few other things that were going on. So we probably would have married earlier if those other crazy things didn't happen. We had, Bridget and Pops, who I lived with as my family, Pops became sick, got cancer, became a patient in my service and died. That all happened in that time. And pre-Richard, we had an unfortunate scenario where my eldest brother, unfortunately, got ill and died suddenly, and it really rocked us as a family because of the strange dynamic that we had as children and kind of and also it happened because of medical negligence in Ireland while he was there on honeymoon. And it brought up this huge court case that I led for our family, for the investigations and for all the work that needed to be done, and the inquest, because of medical issues that had happened, terrible trauma that caused his kids and our family, and just destroyed us. So all that's been going on in the background while Richard and I were first together, and we proved it all to be right, and the family, his kids got like a huge payout because of the enormous gross errors that happened in his care, that robbed them and us of him. So all of those things just made getting married not the right time.
Yeah.
And then we bought our home 5 years ago, and we bought this really old house that a 94-year-old man had lived in, and it became like a huge, almost from the ground up renovation. That's not to do that. Don't do that when you're pregnant and on maternity leave. It's not opening the door to like 40 tradesmen a day for 9 months is not the best way to spend your mat leave. But what we did was literally build our family home, and we emotionally invested in it like you wouldn't believe. And we've now created what is an amazing space that we live in, and our family love and our extended, my nephews and nieces and my sisters and brothers, and we all spend a lot of time there, and it's become a bit of a hub.
And I guess something you never had as a kid. So is it really important that you give it to your kids?
Interestingly, almost like my mum had a house like that. It was a tiny little council house, but it was the hub of the family. Like, you come home from school and you wouldn't know whether there was 4 of you sitting down for dinner or 14, and you were splitting your dinner 14 ways. It was literally like all the teenagers who had problems came to me. So there was I was very used to that chaotic environment where it was, a lot of people in and out the door, and a lot of noise. And I liked that extended family stuff. I liked that having a base. But you're right, the bits we didn't have was the childhoody things and the nice things and the Christmases and all the other things. And something that was very important for me was to create a bit of a safe space so that could happen. So we are very fortunate with the home that we've created, and it's in a really nice area, and the kids are really safe, and they have all their friends over, and Richard's built a pub in the garden. And
built a pub.
And like, I don't just mean a bar, I mean an actual pub. But like my son who turned 16 had 8 of his mates over in the pub, and they played darts all night, and it's got a last orders bar, it's like a full-on bar, and so it's meant that we're able to do that in a really safe way for a lot.
But it's brilliant that you've created your world the way you want it, and blimey, you've had to work hard, and blimey, you've had some heartache throughout the years, but you've still gone through it and created this incredible little family bubble.
And that's how it feels, to be honest. I pinch myself every day. As I drove off the path this morning, waving to Richard with the kids, I was thinking, wow, there's not a day that I don't... you open the window, and the house is called the Coppice, which, means woodlands, and it literally is a coppice. We live in a woodlands, and, it's on a golf course, so you're not overlooked, and it's just got, this amazing, like, nature. You open the door, and you're just blessed with what you can see and smell and hear, and every day, I think, back to, the flat with the druggies, under the stairwell, and running the gauntlet because the light wasn't on the stairwell and you weren't sure whether you were going to make it to the top before somebody intercepted you, and and all that stuff. I just think of how far away. But even then, I had the vision that I knew that that's what I needed to do. I knew that I had to, and I can remember saying to myself at 15, even if it takes me 10 years to get a job and get something that I need, and and some people say you're extraordinarily happy about work and the work that you do, but it's because I've kind of created something that's an extension of me. I feel like my work isn't really, I get paid for it, but I'm very fortunate that I have created something that is literally like a fifth child to me. I love my work as much as I love anything. And it's partly because Clatterbridge is this safe sanctuary for me, and this, amazing, safe place for me. And with that, I've been able to really commit myself to it.
And to grow. Yeah. They've enabled you, given you opportunities to grow, to become you.
And you know what? They have. And like, my service is 14 strong now. Yeah. And that's because I'm able to go, this is what I've done with your money, and I've demonstrated what we've done for patients and what we've done for services, keeping people out of A&Es, keeping people from being admitted, saving your hospital beds, but actually they've trusted that and invested every year because of that, and we now, are now working with NICE to roll it out nationally and lead on national work.
Brilliant.
Yeah, it's great.
I love it.
It's great.
So I want to just finish with, we always finish with a kindness summary. So it's always like, what 3 things would you say, like we've learned or we could do for others to enable others to be kinder?
So after your kindness workshop, where I got to listen to lots of people have kindness, it was held in the Marks and Spencer's.
It was, wasn't it, in Ellesmere Port?
Yeah, Ellesmere Port. The next time I went to that Marks and Spencer's, I was on mat leave with my 3rd of the 4 children. And I went into that cafe and I was thinking, oh, this is the place I went to the act of kindness. And the woman in front of me said, as an act of kindness, I would like to pay for your food.
Full circle.
Oh my God.
It's getting spooky, this.
But I swear to God, I was like, no, honestly, no, it's okay. Because I was a bit freaked out by the fact that I was there reflecting about the acts of kindness thing, and then she offers as an act of kindness. And she was like, I really want to do this. She said, I have had young children and you're there trying to navigate. I was trying to breastfeed and trying to get me a cup of tea, and I was trying to and she said, I'd just really like to do that for you. And I was like, thank you so much. And so when I think of kindness and acts of kindness, there's the literally making a conscious decision to go and do something for somebody. It can be small, it can be massive, but it's going to positively impact for that person on that day. That's kind of like the first thing that comes to mind.
Yeah.
The second thing for me is almost like having a larger plan for kindness. So, I now have created a service that helps people live longer, spend time with their family, and have a better quality of life. It's quite a nice act of kindness, but it's got to be part of a bigger plan. It can't just be, the one-to-one stuff is really important, because you get the positive feedback as to that actually, and that drives you to do it again. And I know that's a bit altruistic, but it's kind of like, if people see the positive it's doing, they're more likely to then itself generates positivity. So I can see the importance of doing something small to get that positive response. But actually it needs to feed into a much bigger plan. I never see a patient ever again now, because my service is all virtual. People don't even know that because of us, they've lived longer. I like that unspoken element of it, where we have this huge positive impact for people and they don't even know that it's because of us. They see the doctors and nurses on the front line and they thank them and they get all that. So there's that part of it. And then the next phase of that is, how do you then build that into authentically being who you are? Like, how does the one-to-one stuff translate into the bigger plan, which is the unspoken stuff, which goes into the next phase, which is actually, it just becomes part of who you are, that actually you're not even conscious that you're doing it. It's a subconscious, it's just, it's just who you are. And that is an aspiration that I would love as part of my soul to be working towards, is that unspoken, unconscious, it's just who you are.
I love that.
Yeah,
I do. I think you're not far off, to be honest, Kate. God, I'm emotional about that. That's just, so you first of all, there's the one-to-one stuff where you go off and you do acts of kindness, but there's this kind of, there's a sense of the secret stuff that you do, which is only about you, because sometimes you do an act of kindness and it's very glory. Oh, yeah. Don't I feel good about myself? Yeah. So there's something there about you doing it, but people don't need to know about it.
Yeah.
And by doing lots of those, actually, it starts to change who you are.
Yeah.
And hopefully that'll get to the point where it is just who you are and you haven't got to consciously...
Yeah.
I mean, I'm not there yet, and I try to do it for Lent, where I do an act of kindness each day. Day 15, I was not feeling
You're
good.
like, yeah.
So there's something where... I mean, I'm certainly not there, and maybe you'll never get there.
I was going to say, maybe you'll never be there, as in one will never be there. I don't think...
I don't know, Dawn Miller, she's quite there. She's so kind.
Yeah, I'm sure she is. I don't know her very well. But...
Oh, everything she does, it's annoying. and she'll just be telling a story, and it'll end up where, oh yeah, and I just saw her on the street. She looked a bit lost, and then and found out she had dementia, and I spent 2 hours trying to get her home. And you're like, that never happens to me. So there's something there though about having to spot those opportunities.
I was going to say, it's people always say to me, you're really unlucky. You are always in the wrong place at the wrong time. And I think, no, it's because I seek them out. So the other day they were talking about people who'd stopped at an accident. And I was like, yeah, the last person I stopped at, he'd been macheted in the head and was in the middle of the road. And people are like, what? And I'm like, yeah, because there is something around, it's not a coincidence. You've got to be able to, you're almost seeking it. You're almost like, who needs it now? How can I help?
Yeah, you are proactive. And that, to me, is that innate kindness, isn't it? When you're proactively...
Yeah.
And it's like I was pedalling down the road and a car just stopped in the middle of the road. I'm like, why is that car stopped? And then there was a blind person trying to cross the road. I mean, I hadn't seen it and I was pedalling oblivious. But it's that awareness, isn't it? That...
But wouldn't it be great? I mean, wouldn't that be aspirational if that's like how you lived? And like, there's something though that you need to refill your tank every so often. So when we were about to launch the guideline, the BBC came and shadowed us for 3 days, and they did a couple of national pieces, and they followed 4 patient stories of who presented on that day. And it was one of the best things that ever... Those 4 patient stories had greater reach than my 24 years career. It literally impacted people more. But there was a real reminder as to why you're doing it. Like, there's a young woman who was at 22 diagnosed with lung cancer, and she got 10 years out of her lung cancer treatment and treated here, which is great. I mean, amazing. Like, beyond amazing. She develops a spinal net, and she goes to A&E, and she's breastfeeding her new baby in A&E. She's got a spinal emergency, and they're trying to lay her flat and keep her flat. She's trying to breastfeed her baby. She's 32. She does one of the patient stories for this video, and she talks about how actually, she could go outside, she could go and do all the dishes, and then she looks and she thinks, but I'm going to go outside and blow bubbles for my kids. Yeah. And you're like literally that one sentence is literally what gets me up every morning. I think, you have no idea, what that is doing for people. Like, when I said to you about the next phase of my work, is how do we get even earlier in the diagnosis? How do we even detect people earlier? Because she was young and fit, which is the older people's pilot stuff coming in, then we were able to, give her high dose. She was able to have surgery and high dose radiotherapy. We were really able to push the boundaries for her. There's loads of people that we could do that for. But what she did, and what those 4 patient stories, because they were very, very different stories, but equally all very empowering and powerful stories. A man who'd become paralysed in the morning. We pushed his scan and we pushed the ambulance to get him here, and he got here, and we reversed his paralysis. And he sends us a photograph of him stood with his grandson. You're like, oh my God, stuff, and but you need to be reminded.
Yeah. When you must get reminded every day. Yeah.
No, because we don't see people. Yeah. We don't see patients. We do lots of putting the moon on a stick, liaising with 15 departments across multiple organisations, and moving a patient from somewhere to somewhere else to have an emergency treatment. And if they don't, they'll be paralysed and dead in 30 days. We do a lot of that, but you're not there with the patient. You're not there with the team, so you're a little bit removed from it.
Yeah. And do you, as we've talked, and we will come to a close soon, don't worry. But your job, it's not a job. It's so ingrained in you. Like, you can't help but talk about it. Yeah. I'm like, let's talk about your personal life, and you'll weave back to work. And I don't think that's because you're steering away from your personal life. It's just because it's who you are. You have made your work your life. Yes, you have a life, but it's so interconnected.
It's so true. And I think that's partly because of that whole... when you think, I'd done some really crappy jobs when I was younger. Jobs that I thought, oh my God, I am not doing this the rest of my life. And, a lot of people say you've got to enjoy your work because, you're there a lot of the time. But actually, it is the majority of your day. Yeah. Why would you not want to be around people who you love, doing something with a shared purpose and doing good for the wider people? Why would you not create something like that?
You've got yourself a right good there, haven't you? Yeah. I love it.
I've literally created that.
Yeah.
That I love being here with my team, doing what we do. I feel I go home of a night time, I've worked hard and I've made a difference to people. They don't even know it. Yeah. on that spectrum of kindness, it's helping me be closer to the end of the spectrum where I want to be.
Yeah, I love it. Is there anything else you wanted to discuss?
Is there anything else I wanted to discuss?
I mean, you didn't know what you were here to discuss
No,
in
I
the
didn't.
first place, so...
I feel a bit emotional myself. I feel a bit like I've just been on a journey I wasn't expecting. No, I suppose it's, that whole take-home message of having been on the end of acts of kindness, you can't ever underestimate that even the smallest act of kindness, how much of a positive impact that will have for people. And I don't just mean the let me buy you coffee kind of acts of kindness. Being kind is much more than just being kind. It has so much more of an impact to people that you can't underestimate its importance. It's literally, for some people, it's literally the difference between life and death. It's literally the difference between what makes... I think it's fundamentally is the way people think love is what makes the world go round. I think kindness is an extension of love, and so therefore is as profound as one of the main things that makes the world go round.
I like that. Kindness is an extension of love.
Mm-hmm.
That is a good place to finish. Thank you very much, Kate.
No, thank you.
Thanks so much for listening to this episode of Curious Chats and Kind Acts. It was lovely to have you. Can I just say a massive thank you to all the people that we've interviewed who have been so honest and vulnerable with me so that we can have these real life stories to share with you, our wonderful listener. And remember, we'd love to hear what random or small acts of kindness you've been up to so that we can maybe do a few. Find us on all the socials, TikTok, Facebook, Instagram and Twitter, and all our /ActsGB, that's ACTSGB. And drop a comment on our feed, tweet us, or even send a photo. Let's build our kindness community together. We'll read some of our favourites on future episodes of Curious Chats and Kind Acts. And you never know, we might even have a go at a few of your ideas ourselves. Watch this space on the socials. For more information about the Acts charity, including how to donate to us, head to actsonline.uk. See you next time!